So good morning, everyone, and good afternoon in other jurisdictions. It's definitely morning here, but here today to talk about one of our recent studies, prevalence predictors and wage replacement duration associated with diagnostic imaging for accepted low back pain claims. So before I get started, I'd just like to note that this presentation uses data supplied by WorkSafe Victoria, WorkCover Queensland, Return to Work South Australia, and WorkCover Western Australia. And the views expressed in this presentation are those of myself and my co-authors, and not necessarily the views of these organisations. I'd also like to thank the four organisations for providing data, and they did not provide any funding for this study. So clinical practice guidelines over the last 30 years, including those for compensable low back pain, consistently recommend against imaging for a new episode of low back pain unless clinical assessment suggests the possibility of a serious pathology such as malignancy, infection, or fracture. Abnormalities are common in people who are asymptomatic for low back pain, and this increases with age. So their presence on imaging results is not helpful in guiding diagnosis or management in individual patients. And early imaging can lead to unnecessary further tests and treatments or more invasive treatments that can cause more harm than good. But we know that 1 in 4 people in primary care and 1 in 3 in emergency care are referred to imaging, and the rates of complex imaging, so MRI or CT, have actually increased over time. Low back pain is a prevalent symptom. It's usually self-limiting, but it can lead to a great deal of work disability. And if someone is unable to work, they may seek financial support from a workers' compensation system. Workers' compensation in Australia, like other jurisdictions, pays for wage replacement and also pays for healthcare, which can include imaging. There are over 56,000 workers' compensation claims for low back pain in Australia longer than 2 weeks between 2010 and 2015. And we know from international literature, notably from North America, that approximately 19% of compensated workers are likely to receive an MRI within the first 6 weeks of symptom onset. Imaging, particularly early imaging, as I noted before, in workers' comp has been associated with longer wage replacement duration. And workers who receive imaging are also likely to receive more invasive procedures such as spinal injections, surgical intervention, and have increased overall health service costs and service use. So, like I said, previous studies have typically been from North America and Canadian settings and have explored overuse of imaging there. So in our study, we sought to determine in Australian workers with accepted workers' compensation claims for low back pain, the prevalence of diagnostic imaging of the spine and the demographic and claim-related factors associated with its use, and the association between spinal diagnostic imaging events and wage replacement duration. Australia has workers' compensation schemes in every state and territory. So there's 11 in total. There's 3 national schemes as well. This study was conducted using data provided by workers' compensation regulators in Victoria, South Australia, and Western Australia, and 1 large nominal insurer in Queensland that covers about 80% of the state. So you can see the Victorian states and territories there. We included claims from these jurisdictions where the worker was aged between 15 and 80 years with an accepted workers' compensation claim for low back pain lasting 2 or more weeks with a reported date of onset between July 2010 and June 2015. So that's 5 Australian financial years. We should note here as well, the claims from Queensland were from 2011 onwards. So there's the first year missing from that jurisdiction. We had various aspects of data here. So the claims data we have, that's really 1 record per worker from all jurisdictions was worker sex, age, occupation, socioeconomic status, and remoteness, and also total time off work. These are the same kind of variables that we've used in previous studies of workers' compensation schemes. But what was new for us is we've had services data, so multiple records per worker. And that's where we found diagnostic imaging. So diagnostic imaging was identified by matching data to Australia's public healthcare scheme standards, the Medicare benefits scheme. Those that didn't match, we manually screened with 2 authors. We included spinal imaging services that occurred on or after the 1st of July 2010 and were within 2 years of the worker's reported date of low back pain onset. Workers were then categorised into 3 mutually exclusive groups based on the number of diagnostic spinal imaging events in the 2 years since their reported date of low back pain onset. So that was no imaging, single diagnostic imaging, and multiple spinal diagnostic imaging. From there, we calculated the prevalence of workers in each group by all the claim covariates. We used multivariate ordinal logistic regression to assess the likelihood of being in one of those groups. We also reported descriptive statistics on imaging modality, so what was the type of diagnostic imaging. And finally, we used a Cox proportional hazards model to assess the relationship between diagnostic imaging and wage replacement duration, effectively time off work. So what did we find? Well, we had a sample of 30,530 workers with claims for low back pain lasting 2 or more weeks. Almost a third of workers received one spinal diagnostic imaging and 20% received multiple spinal diagnostic imaging, with the remaining 49% receiving no spinal diagnostic imaging. Male workers and workers from the state of Victoria had significantly higher odds of multiple imaging, and socioeconomically advantaged workers and workers from remote regions had significantly lower odds of multiple imaging. Kind of makes sense for remote regions in Australia. When you're remote in Australia, you're quite remote, lower access to healthcare and so forth. The most common imaging modality was MRI, which we would expect for cases of low back pain. So 36.3% of our cohort, it's about 11,000 people, received almost 15,000 MRIs in those 2 years from their low back pain onset. Workers who received no spinal imaging during their claim had the lowest median wage replacement duration at 6.1 weeks, which you can see here. Wage replacement duration was significantly longer among those who received both single and multiple diagnostic imaging during their claim. You can see from the Cox model here, those are inverted hazard ratios to make sense of people being off work longer, but it's substantially longer for people who had multiple imaging in those jurisdictions. So what do we think this means? Well, the prevalence of imaging for low back pain is higher in compensated workers than in the community, although we should note that these are quite serious claims with a minimum of 2 weeks off work already. So if we had claims with any time loss, or even claims with no time loss, we would expect that prevalence of imaging would probably come down. The prevalence of imaging is higher than what we would expect if everyone was receiving guideline adherent care. And we think this might be driven perhaps by healthcare providers who might provide imaging to beliefs or routine practice, to provide reassurance to workers, or to meet their perception of patients' needs, or out of fear of litigation in some cases, we know from some previous literature. What we also know is workers' compensation in Australia, like in Canada and North America, is cause-based. It's a cause-based system where a definitive diagnosis might be sought to associate somebody's low back pain with work, which is a requirement of receiving support from workers' compensation. The increased wage replacement duration is associated with imaging, is consistent with previous findings. We theorise that the use of imaging may lead the worker, the healthcare provider, or the workers' compensation system, so any of those three stakeholders, to erroneously contribute the source of low back pain to some sort of anatomical structure or structural damage that we know, as I mentioned earlier, often shows up in asymptomatic people. A stakeholder like the worker, the healthcare provider, or the system may then expect a complete recovery, which may in turn trigger the use of more invasive procedures, which may then delay functional recovery. For example, people who receive lumbar spine surgery then often go on to require opioids. It turns into a cascade of healthcare, which we've observed in studies from North America as well. Ultimately, this would lead to longer wage replacement. It's important to note one of the limitations of our studies, though, is that we can't really infer causality between imaging and wage replacement duration. We don't really know the direction of that relationship. It may just be that people who are off work longer had longer time in which to receive multiple imaging without information such as pain severity or psychosocial factors, which unfortunately we don't have in administrative data. We can't really make a determination on causality there. Yeah, thank you for your time, everyone.